My name is Rebecca Sewell. I'm from Gaylord, Michigan. I'm a registered nurse, and I had the iFuse SI joint fusion in May of 2018. I originally started having pain about 5 years before my procedure. It just started gradually, where I noticed that it was difficulty, or if I moved just right, I would have a stabbing pain, and it would kind of go away. And it gradually progressed that it was almost constant. Stairs were extremely difficult. I had to make sure I held onto a hand railing got to the point where I avoided using stairs at all. If I could, I would use an elevator. I had difficulty sleeping. Slowly, I was unable to do more and more things around the farm, like feed the animals very easily, get on the tractor, take and move hay. All those things were very difficult. Walking on uneven ground, you had to watch where you walked. The big motivating factor was when I started falling down, especially in the winter. If it was a little bit slippery, I would fall right down. I went to see a pain specialist, and he did some steroid injections into the SI joint, trying to decrease my pain. They worked short-term only for a few weeks, it seemed like. And then I went into having the RFA, which is the burning of the nerves for the spine. And those were effective, but you can only burn the nerves so many times. And that's when I went to see Dr. Bozzio.
I'm Anthony Bozzio. I'm an orthopedic spine surgeon in Petoskey, Michigan. The SI joint is the joint in the body that links the spine to the pelvis, and it undergoes a lot of physiologic load. It's supported by some of the strongest ligaments in the body, but oftentimes it can develop abnormal motion, and that abnormal motion can become painful. Some of the causes of SI joint pain are age-related degeneration, trauma. There's an increased incidence with people who've had prior lumbar spine fusion, and sometimes the SI joint can be painful and we don't know why. People notice oftentimes pain with certain activities. They notice pain with going from a seated to a standing position, pain with prolonged sitting, sometimes pain that keeps them up at night, pain that's located sort of in the lower back to buttocks area. SI joint dysfunction can lower somebody's quality of life. In terms of the prevalence of SI joint pain, it's thought to be higher than is what's actually diagnosed. I do see a lot of patients who have gone through a prolonged and pretty extensive workup before it's finally determined that they have sacroiliac joint pain. I look at the SI joint and I put patients through specific testing in clinic, and that involves a series of provocative maneuvers to try to elicit pain from the SI joint. Once we've determined those specific tests have caused the pain for them, what I do is I do 2 injections to see if that time of injection elicits the pain response, and do they get immediately better with the anesthetic that's included into the injection. And then after the second injection, we can decide, do you want to go down a road of non-surgical treatment, and that would be anti-inflammatories or Tylenol, physical therapy, injections, radiofrequency ablation, and supportive belts. Those are sort of the mainstay of non-surgical treatment options. For the people who move on towards the pain went away, now the pain's back, and we do that twice, I consider SI fusion. So in terms of the surgery itself, the surgery is done through a 2 to 3 centimeter incision. The entire surgery takes about 45 minutes, and typically patients are discharged home the same day. If someone's interested in pursuing a sacroiliac joint fusion, I use the iFuse implant, which is a triangular-shaped titanium implant. And what that does is it crosses a sacroiliac joint in typically 3 locations, and it allows for bone to grow onto the implant as well as through the implant, and it stabilizes the SI joint to resist the forces of rotation across it.
When I came home from surgery, I was non-weight bearing on the left side, which is where I had my SI joint fusion, and I had to use crutches. I was able to progress from non-weight bearing to toe touch weight bearing. I think it was about a week, and as I felt stronger, I started to be full weight bearing. Had my first follow-up visit with Dr. Bozzio at 2 weeks, and he scheduled me to go to physical therapy, and that really helped immensely. I went back to work full-time as an RN, doing 12-hour shifts after 12 weeks. And now I'm relatively pain-free, and I can get back to all my usual activities.
In terms of clinical results, SI Bone has done a lot of research in this area showing good quality outcome measures for patients. There's a high level of evidence now suggesting that this is a good surgery for the right patient.
Well, if you're like me and have had injections and RFAs where they're burning the nerves and you're still having issues, I would seriously consider seeking out for a consult with Dr. Bozzio or a competent surgeon. I am so glad that I'm back to normal. Having this surgery has been a life-changing event for me, and I would recommend it for anyone that needs it.